Hi, I'm Dr. Julie Steinauer, and I want to talk to you today about a topic that is a really good one that came in as a question online from someone. And that is, do I get to stop vision therapy at some point in my life, or do I need to go in for boosters? Do I keep doing it forever? What's the deal after I've gone through vision therapy? Does it really stick? And before I answer that, let me tell you about how you can connect with us. So there's a couple of ways. If you're local, you can call us at 618-288-1489. Now, if you're not local to us, we recommend that you go to our website first. Go to visionforlifeworks.com, and then you've got two choices. You can either fill out a questionnaire, or if you followed me for a year or 6 months and you've watched lots of videos and you're ready to do something about your vision, then schedule a consultation with me. There's a little button that you can click and it will take you through all of the next steps. Now let's go back and talk about, am I in VT forever mode? All right, so this question is really common, and I thought it'd be a great one to address in this Ask Dr. Julie segment. But many patients want to know, when I'm done with therapy, what will I need to do? The best way I can describe this is to tell you that it's very similar if someone were to go get braces on to realign their teeth. Right? I've actually done that. I got Invisalign just a couple of years ago, and before that, I had worn braces twice. Once as a youth around 5th grade, and then again in my high school years. So if you've had to wear braces, I really recommend that you wear your retainer when the doctor tells you to wear the retainer. All right, the fact that I had to do it 3 times, and I paid for it a couple of years ago with Invisalign as an adult, means that you should wear your retainers. Well, all right, vision therapy is not a lot different. If you want to think about the whole, again, kind of like, let's talk about how this is similar to dentistry and the alignment of the teeth for the orthodontia work. Well, you're chewing and you're talking, and there's lots of movement of your jaw throughout the day, much like your eyesight and your vision is going constantly moving. Your muscles are moving the eyes around. You're constantly refocusing, realigning, tracking, all of these things all day long, all through the day. Similar to your talking, the jaw is moving, you're chewing food. There's lots of ways that things can kind of get unbalanced or misbalanced again with your jaw and your teeth. The same that there are lots of ways that things can get misbalanced or unbalanced again with your vision. If you don't have good visual hygiene, where you're working 12 hours a day on the computer, and then you go home and you're on your phone or your gadget or your device for another few hours, and then you sleep 3 hours a night and you're back up in the morning, you're on it again. Okay, so there are lots of things that you kind of have to do for visual hygiene, and if you're not one that can follow it or does follow it, then you want to make sure that when your vision therapy program is complete, that you are following your doctor's recommendations. Now, years ago, because I've been doing this for 20 years, I didn't really take it as seriously. I would say, check up on your vision every now and then. Now we give a pretty rigorous program at the end, and we tell our patients they need to do something monthly. Sometimes they need to do it weekly. And then we'll give them a time span of how much time they need to work on it, and we recommend the activities they work on. Now, my dad, who did vision therapy 20 years ago, and he is a spry age of, how old is he? 78 years old. He still periodically pulls out his tools every now and then and just makes sure that his brain is processing his vision correct. It's not like it takes a ton of time. But if you went to the trouble to get yourself all healthy, and you worked out and you lifted weights and you ran and you watched your diet and you made muscle gains and you did all of these things that were so fantastic, and then all of a sudden you decided to just gonna just let it all go. Well, it wouldn't take long for you to get out of shape again. And it wouldn't take long for those muscle gains to kind of be a thing of the past. And it wouldn't take long for you to feel like, I'm probably noticing a little bit of a change with my body too. So you definitely want to keep up on vision therapy activities at the end to maintain the things that you've learned. Now, that being said, it is important for you to realize that once the brain learns a new pattern, it won't forget it. It just means that at times it might choose not to use it because it's lazy and it's easier to do an old pattern. Especially if you haven't been real great with your visual hygiene. It'll just go back to a lazy pattern that is faulty, as opposed to using the new pattern of maybe eye alignment, proper focusing skills that you were taught in a vision therapy program. So to wrap it up, yes, you do need to do continual activities. The amount of time that you need to do them is based on your individual problems kind of going into your vision therapy program, and it should be discussed with you by your doctor. If it's with our clinic, then we're going to recommend specific things for you to do at the end, and you will have equipment to do that. And then when we follow up with you, we'll want to follow up to ask, how are you doing? Are you continuing to work on these activities now that you're finished with therapy? It's very important because we want you to retain what you've learned, and we want you to continue to have good vision for as long as you can, the rest of your life, actually, so that you can have success. Now again, if you want to contact us, you can do one of a couple of things. If you're local, call us at 618-288-1489. If you're not local, you can go to our website, visionforlifeworks.com, and you can fill out either a questionnaire, or you can click that button and schedule a consultation direct with me, and we'll talk online, face-to-face, in a video consultation about how we can help you. If you like this video, or you feel the need to pass it on because you know someone could benefit, then pass it on, hit the like button, and if you haven't already, subscribe to our YouTube channel. Thank you.